And I will get my slides going. Okay. So you should be able to see my PowerPoint at this point. If you can't, just unmute yourself and let me know. So this talk today will be recorded and posted on our websites, but we ask that we keep question and answers for school staff and health department staff just for the sake of time. Please pass on any needed information to the rest of your staff. Just wanted to let you know, and we'll pass this along with our slides and with the data sets that we pass along, and I believe all this has already been posted on our websites as well. But MDHHS did finally come out with some end of year gathering guidance, which essentially covers prom and graduation. They are recommendations. It is not necessarily rules, although the references to the gathering limits and things that's from the epidemic orders, those are the rules. But they give some other recommendations of other ways to help keep things safe. So there is a link there, but if you go to the michigan.gov/coronavirus on the top right, top of the website, there's a tab that says resources, and then there's a tab there that says K through 12 school opening guidance. If you go to that area, you'll find that resource. Other useful areas, if you go also to the resource tab, at the very bottom, there's a tab that says state orders and directives. If you go to the April 19th gathering and face mask order, it is somewhat easy to understand. I know it's a little bit, legal jargon, but that will give you all the information of what you need to follow. There's also a fact sheet about capacity limits on that website. I meant to delete, I kind of copied and pasted here, but the enhanced outdoor stadium and arena guidance probably doesn't have much usefulness for this application. The dining guide does have illustrations of indoor and outdoor facility options. So that actually does have some useful information for you. And then the frequently asked question link, I find to be very helpful. It's a bit long, but it does have a lot of good information to putting the epidemic order into more user-friendly discussion. This was just released this morning. The governor did have a press conference and did put out a press release. This is kind of the newest initiative, basically using the percent of the entire population of Michigan that's received one dose of vaccine, to use that as a marker to help get rid of the different restrictions or mitigation measures that we have in place now. So again, this came out in a press release today. The first one we are pretty close to. So when the entire state has hit 55% of the population, or I should say the average is 55%, 2 weeks after that point, they'll lift the requirement that everyone that is able to work at home must work at home. We're at 48.8% right now. Of note, 17 of the 19 counties that I cover or that are invited to this call are below that 48.8% right now. So, just something to keep in mind, but it's going to be a statewide discussion. The other thing is this little cross mark here. If cases remain at 250 per day per million, that might be delayed, and that cross mark applies to the other two marks as well, here the 60 and 65%. So there are some caveats, of course, but attempt, hopefully, to get our vaccination rates up so that we actually will have more benefit to reduce our spread. Quarantine, we know quarantine is a continued concern. I'll kind of jump to the bottom bullet point here. We truly are closely watching our numbers, the number of outbreaks we have in our schools, the amount of variant activity we have in our counties. And we are, and by we, I mean myself, our health officers, our CD staff, others, we do regularly discuss what the best quarantine time is. We don't want to decrease it prematurely because we don't want to have a backslide. We still do have quite a few issues with school outbreaks. Things are starting to decrease, which we'll talk about, but we're still dealing with some extremely high levels. So just to know that we're not just setting it and forgetting it. We are discussing this quite a bit, and really, at least for myself, it is a very big anxiety producing situation. It's one of those things where, we're not happy about any of these situations. And so I don't want you to feel like we're being real flippant about it. But just as a reminder, we do have some quarantine guidance. It's either called quarantine guidance or quarantine explanation on each of our health departments' school COVID sites. So if you have people wondering, why is it 14 days? The CDC says X, Y, or Z. That is some detailed explanation as to why. There's been some newer evidence since I put that handout together. It looked at 185 individuals that were close contacts to a household individual. So we know that that is a higher risk situation, but it's kind of the best that we have. But essentially saying that, those people that were negative and asymptomatic at 10 days, between 2 and 22% of them, or on average 7% of them overall, went on to become positive by 14 days. So kind of rounding that, about 1 in 10 people went on to become positive after 10 days if they tested negative at 10 days. So, a month ago, that may not have been a major issue, but with our variants and how quickly they're spreading, again, we want to wait and make sure things are in the right path before we switch to prematurely back to 10 days. Hopefully it'll be soon though. This also came today. I just want to share it. If for any reason you want to share it on a Facebook post or on your website, it's certainly an optional thing to do. But this letter came out from the Michigan Hospital Association. It was just a letter to healthcare professionals, but also families, just as a reminder that the multi-inflammatory syndrome typically appears in children several weeks after COVID infections, and oftentimes actually kids never had a symptomatic infection, it was asymptomatic. So it's just a reminder for families to watch for symptoms of this, since we had this large peak of COVID, and it was especially prevalent in children this last time, that over the next 2 to 5 weeks, we might see more of these cases. So just a reminder for parents to watch for these symptoms. I just copied and pasted a little bit from that letter, which included the symptoms to watch for, but the link is here. And if you just Google Michigan Hospital Association, letter, it should pop right up, but, just something to consider sharing. We do have these cases in Michigan. This was as of April 15th. I know for a fact there have been more cases since then. But again, they only update it a couple times a month, the first and third Thursday of the month. So it should be getting updated here soon. But we've had just over 100 cases as of April 15th. But again, just to be aware, and there have been some deaths in Michigan. Fortunately, not many, but there's been many amputations and things like that. So again, just sharing that information. For our data, things continue to stabilize and improve a bit. Pointing out that we're still, way up in the 300s, 400s, 500s cases per million, but still going in the right direction. So Michigan is down from 608 to 463 cases per day per million, and 13.3% positivity on testing, down from 15.3. The 6 counties of Central are at 451, down from 587, and percent positivity is at 14.1, down from 17.2. Again, these are still significantly higher than we were a few months ago, but still we're heading in the right direction over the past couple of weeks. Same thing for District 10. We still have a few counties that are pretty high in cases per million and in percent positivity, but the overall trend has gone down to 392 from 560 and to 15% from 20%. And the 3 counties of mid, same scenario. Percent positivity, though, is pretty stable. It went up just a tiny bit. Mostly it looks like Montcalm bumped up a bit, and the cases per million went down to about 430 from 507. And we'll send this out to all of you. And this is from the mystartmap.info website if you want to look at it yourself. So this is the state information from the state report. So again, overall, the state's gone down about 14% from last week, and it went down 11% the week before. But again, we're still over 300% higher than we were in mid-February. So we have a ways to go to get down from where we were, but at least things are decreasing. And Michigan continues to be one of the highest in the state, sorry, in the country. Our percent positivity is trending downward. Again, we're still not down to where we were before. We're still, I would guess, about the same or higher than where we were at our peak in the winter, but at least we're going in the right direction. Our hospitalizations for COVID continue to decrease. They're still very high, but again, we're going in the right direction. Last time I shared this curve with you as well. This is the percent of visits to the emergency room that were for COVID-like illness. I think last time it was around 10% or over 10%. Now it's around 7.5%. Still a lot of emergency room visits for COVID, still more than we had seen in the winter, but again, it's going in the right direction. So we'll cross our fingers and hope that that continues. The percent positivity for this last week is over here on the far right. This is for testing. Darker colors means higher percent positivity. Again, we still have some hot spots, but looking back over last week and then on the far left to 2 weeks ago, things are lightening up. So I really appreciate those of you that have helped with pop-up testing sites. If there are any of you who would like to have a pop-up testing site in your school or anywhere in your community, I can help you with those connections. But getting more people tested can help with our percent positivity, but it also helps identify illness so that we can do more to control it. So, but again, seeing that lighten up is a good thing. This is our age group. This is the average new daily cases per day. So this is the same exact order that it was in last week. This gap between the 10 to 19-year-olds and the 20 to 29-year-olds is bigger. So our new cases is still highest in our 10 to 19-year-old age group. So that's another reason why I'm leery to lighten up on quarantine and things, especially in our school-age kids. So I know it's difficult, but they do just seem to be a large reservoir of our illness at this point. So again, it's the same order. Our younger age groups are our highest number of illnesses right now. These are our variant cases. Again, it's just going to be, this is kind of the new normal. I think eventually it'll just not be that interesting anymore. but nearly all of our counties have had a variant reported. I think the others, they just haven't tested the right people. B117 is now the predominant variant in the country and in Michigan. The darker orange counties are the ones that have 2 different types of variants that have been found. The blue ones have had 3, and the red ones have had all 4. There's now 4 that they're watching. This is getting too busy, I know, but just you can kind of see the color trend. Initially it was just B117, and then we kept adding in more and more different variants. So just to see that more of the state is affected, and we're getting more and more identification of different variants in different counties. The number of outbreaks, our K through 12 schools are still at the top, but manufacturing and construction has had the biggest increase in outbreaks this past week. I think more and more construction's being done. More and more people are working. So that is becoming a bigger source of outbreaks. The number of school outbreaks actually went down this past week from 312 to 282. So that's a good trend to see. Unfortunately, we had I didn't cut that out. So we've had quite a few ongoing outbreaks. We only had we had 4 new outbreaks in junior high, no new outbreaks in any other school level. I meant to cut this out, I'm sorry. It gets kind of hectic trying to do all these things while doing 42 other things. So I'll correct this before we send it out. But we had 1 more ongoing outbreak get added, but we've had more cases get added to some of these ongoing outbreaks. So of these 29 outbreaks that we have going on in our 19 counties, it went up to 162 cases altogether involved in these outbreaks. So again, we still have quite a few outbreaks just kind of hanging on. The turnaround time for testing is pretty stable from last week. It's still just a little bit longer in the commercial labs. It usually was right around like 1.7 to 1.9 days. But in the hospital setting, it's been about the same. So you should not really be seeing too much trouble getting test results back. Hopefully that's not a factor holding you back. And then the last couple slides are just some predictions. This one's from U of M. Just predicting where we should be going, hopefully. So this darker gray bar is what's most likely. So they're predicting that we should kind of slowly taper off. Unfortunately, May is down here, so it's kind of projecting us, well into the late spring, summertime, coming back down to where we were in February. This website, it's COVID19 Sim for simulation.org. They have some interesting information there. This is just another simulation. This big gray bar is kind of the margin of error, and the gray line is the average or the most expected course. So again, expectation is we'll start dropping off. And the earliest we'd get back down would be June through August. So again, we're seeing a promising trend. It's going to take us a while to get back down. So that's why we need to be cautious that we don't turn completely 180. All right. So I think there's someone who may not have their phone on mute or their computer on mute. So I'd ask you to check that for me. I'm going to stop sharing here. And I'm going to get to my questions. Add any questions you may have to the chat box. And then at the end, I'll open it up to phone calls. Just gotta find the beginning. So I'm hearing that Kent and Muskegon counties, I am hearing that Kent and Muskegon counties that MDHHS is going back to 10-day quarantine after close contact tomorrow. Is this true? And if so, do we go retroactive? So I know that Kent decided to go back to 10-day quarantine as of tomorrow. We have heard nothing, unless one of my health officers on the call has heard something in the last 1 hour from MDHHS, but we have heard nothing about the state going back to a 10-day quarantine. They're at a 14-day quarantine, and they've left it to the individual health departments if they want to go shorter. And last I knew, only 6 counties were at 10 days. I know that, a few more have added on, but it's still the minority. So again, if someone has heard something new from MDHHS in the last hour, can let me know, but I don't think it's happened. Regarding the quarantine guidance for the folks that are vaccinated, does a 3-month period, okay, so for vaccination, there is no expiration date. For vaccinated individuals, once you're fully vaccinated, which is 2 weeks after your last dose, whether it was 1 dose or 2 doses, once you hit that 2-week mark, if you're exposed at the 2-week mark or later, you do not need to quarantine. There is no longer a 3-month time frame on that. There is still a 3-month time frame after infection. Why, I'm not sure. So just know that it's 3 months after infection, but right now it's no time limit on vaccination. The evidence does suggest that vaccination does provide a more robust immune response. What is the expectation after international travel if fully vaccinated? If fully vaccinated, you do not need to quarantine or test after travel. Do we get specific data on deaths and other complications due to MISC? So that information that I shared was from the state website, so that is publicly available. Since there's so few cases, we really can't share like specific information because it's really identifiable. But that information, and I put the website on that slide. So when you get the slides, you'll be able to go to that website and look. And then the CDC also has a website with information for nationwide. But often we don't share specifics on complications and things because, again, it's personal medical information. When I was looking at the internet about it, there's news stories about a lot of the individual situations, like about a little boy who needed 4 amputations in Michigan and things like that. But that's stuff that the family has chosen to share personally. Again, we're not allowed to share personal medical information like that. When do you estimate that the MIOSHA order will be lifted? More than 2 weeks from now. That's the best answer I can give. So again, we would need to hit the 55% mark for 1 vaccine on average statewide, and then 2 weeks after that. And then MIOSHA would have to decide that the rates in the state are low enough, which they're saying is less than 250 per million. And as you could see, our counties are pretty much all of them are well over 250 per million. So I can't really say for sure, but the faster people can get vaccinated, the sooner that will be. For 50+ years, the 8th grade students in Ludington have spent a week at Grace Adventure for Leadership Development Camp. We have canceled the camp and overnight stay at the camp for our 8th graders. However, the camp staff has planned to come to Ludington to complete on-site outdoor team building and leadership activities during the last week of school. Do you recommend cohorts of students in limiting contact for an event like this as discussed for end of year events? Are we required to cohort students? It's recommended you cohort students simply because then if there's an exposure, it exposes fewer kids and it's easier for you to do contact tracing. If you don't cohort and someone ends up being sick, you may have to quarantine a huge amount of people and you could infect a huge amount of people. So it's always a good idea to do that. I think, if you work to try to keep things distanced and have people following safe measures and it's outside, I think you can do that in a safer way and have that event for them. Do you think we need to get boosters for staff before returning in the fall, or their current shot should be sufficient for a while? So hopefully their current shots will be effective for many years. But that kind of information is stuff we're going to have to learn as we go along. And it will be dependent, on how much does the virus keep changing? Is it going to change enough to make the current vaccines not as effective? So will we need boosters? Like we need a new one with the flu shot every year? Will we need one every 5 years? So there's so many of those kinds of questions we're not going to know for a while. I would be shocked if they would need a new vaccine before this school year. That would be shocking to me if it would be that fast. I would really encourage your staff, though, if they haven't gotten vaccinated yet, to do so as soon as possible. If there's some reason they can't do it now, or if you have new staff that you hire over the summer, to get vaccinated before school starts. But again, I highly doubt that there would be a change before August. But whether or not we'll need boosters over time, that's something we're going to have to wait and see. That was the last question in the chat box. If anyone wants to add another one, or if anyone wants to unmute and just ask it, go right ahead.
So just to confirm and clarify, we are staying at a 14-day quarantine, correct?
Yes.
Thank you.
All right. Well, we will get that information sent out to you.
Dr. Morse, I do have one more question.
Yeah.
The CDC lifted the mask mandate or whatever it is for being outdoors. Currently, I think, I don't know if it's through the MDHHS or the MHSAA. I know somewhere in there I read that if there's spectators at outdoor events like track and field or baseball, softball, etc., the spectators should be wearing masks. Where are we at with that?
Thank you for reminding me. I meant to put that in my presentation. There was another thing discussed on the governor's press conference this morning. They are going to be updating the epidemic order to reflect some of those changes. I don't know which ones, and I don't know how much so, but you are right. The CDC said now that if you're fully vaccinated, you can loosen up on outdoor mask wearing. And there was also some discussion about routine testing and things. As you know, our epidemic order mandates like sports testing and wearing masks whenever you're in groups, which would include, outside at recess, at a ball game, things like that. So my hope is that the order will reflect all those changes, but we just kind of have to wait and see what comes of it. While you were asking your question, I pulled up the epidemic order page and there is nothing new put up there. So I'm not sure when that will be posted, when that will come out, but that was they did say that they are going to make some changes to it. So basically, yes, the CDC made that recommendation, but our state requirements still have masking outdoors as a requirement, and we just have to wait and see when that changes. Any other questions? All right, well, we will post the materials, and for those health departments that email them out, we'll email them out as well, and let us know if you have any other questions. Thank you.